Good afternoon. My name's Tracy Newman, and for those of you that I haven't had the pleasure of being on a webinar with before, I am the Vice President of Prevention and Employer Engagement here at WCB Nova Scotia, and we're happy to be here with Lisa Scallion and Daniel McCann to talk about the Work Connected Recovery model with you this afternoon. This is our ongoing commitment to make sure that we're providing as much information to you as employers as we can. I'm just going to get one of my colleagues to flip to the next slide so we can do some friendly reminders if you don't mind going back one. Just so you know, this webinar is going to be recorded, and that's so that we can provide this to anybody that wasn't able to join us. The recording will be available on our website in about a week's time or so. We have all of the participants at mics and cameras turned off except for those presenting to minimize disruption. We will have a question and answer section at the end. Please feel free to post your questions in the chat box, and we have a team behind the scenes that will do their very best to respond to you. Included in the response of the chat is Matt Ross, our Director of Employer Performance, Jonathan Berg, our Manager of Health Services, Janice McPherson, a Health Services Portfolio Manager, and Morgan Soley, also a Health Services Portfolio Manager. And this team will be busy behind the scenes making sure that we can get to as many of those questions as we can. If we don't get to your specific question, don't worry, we will provide responses to all questions as later on. We will post a Q&A that will accompany the recording in about a week or so. If you do have a question about a specific claim, we would encourage you to please contact your WCB caseworker, or if you work with a business partner or workplace consultant directly. I'm just trying to think if there's any other reminders. I don't think so. So we'll move to the next slide. And as I mentioned, I'm joined by Lisa Scallion, who's our VP of Service Excellence, and Daniel McCann, our Director of Health Services. And Lisa and Daniel will be walking you through the Work Connected Recovery model. I'll come back at the end of the presentation and host a little bit of a question and answer period. Lisa and Daniel have included the most frequently asked questions throughout their webinar or throughout the presentation. So some of those questions may be addressed, but if not, we'll be back at the end and try to get through as many as we can. So Daniel, I'm going to hand it over to you.
That's great. Thank you. I'm just going to see if I can advance the slides here. Righto. Well, firstly, thank you, Tracy. It's great to be here with Lisa and the whole team. We're really excited. I really want to thank folks for tuning in. Our team and our organization has been working hard to try to make things better. And I want to walk through a little bit about the Work Connected Recovery approach here. And first start off by talking a little bit about what led us here. And we have a lot of people on the call, which is fantastic. I see the people at 230, and many of you would have been part of that review. And so that review is the independent review of the workers' compensation system in Nova Scotia. And it released its report at the end of 2024. And the report showed some things that many of us have seen, that the system was too slow, it's too complex, and it led to poor return to work outcomes. And in fact, although we're making progress, and we're going to continue to do that, of course, Nova Scotia does have the highest rates in Canada for lost time from work, the highest healthcare costs, and this is tough as well that we need to bring approaches to, has the highest likelihood of permanent impairment following a workplace injury. In fact, the review found that a lack of timely access to healthcare providers is also a barrier that affects recovery and return to work, and that the WCB needs to take action and develop strategies to make this better. And so the Work Connected Recovery model is part of that. And we are acting on what we heard through the accountability, and together with our strategic plan of protecting more, the Work Connected Recovery program is our approach to bringing better access to clients and supporting safe and sustainable return to work. The why behind this is what everybody knows on the line is we're seeking to support Nova Scotia strong and healthy, a stronger and more sustainable workforce in our province. And as our first objective is prevention, but as injuries happen, work to minimize the impact of workplace injury. Currently, WCB has, there are 20,000 employers that are covered by Workers' Compensation Board and nearly 400,000 workers. If that's not a real strong why to get behind, it is indeed. Every year, WCB Nova Scotia supports over 10,000 workers with both physical and psychological injuries. And we know that there's opportunity within both of those types of injuries. From a physical perspective, following normal recovery guidelines, we know that we can do better. That sometimes our treatment rates are 3 times what other provinces experience for similar injuries. And then from a psychological perspective, psychological injury perspective, we want to ensure a system of providers that can provide access to care quickly. We know that that matters. And as of today, we still have quite a delay in terms of accessing care. In fact, it's almost 6 weeks from when somebody is referred before treatment begins within traumatic psych injury. So this work-connected recovery program is for both physical and psychological injury. And for that psychological injury, we're looking to reduce that wait time by half or more. So the problem is we have a disconnected system. And alignment of goals of supporting safe and sustainable return to work is at the center. As I had mentioned, care and recovery are too slow, and we can do better. And care is inconsistent for injuries across our province. And so we want to unite in a strong community of leading practitioners following approaches based on normal recovery, and that is our opportunity as we move forward. So we're rethinking recovery, and this is what we know to be true. That Nova Scotians deserve timely, consistent access to care, and that the system can be improved with accountability of all of us on the call and all of us that support recovery and return to work when workplace injury happens. We also know that folks do better and feel better when they're connected to work as part of recovery, and the networks and community that work brings really supports how folks progress through recovery and returning back to normal from as per before the injury. We have many exceptional providers in this province, and we want to kind of surface and accelerate that great practice to support individuals through treatment, recovery, return to work. And we know there's a lot of things within our system that we should continue to do of how we connect together and rally around people to support recovery and return to work. And so this is our focus to make things better. So the solution is the Work Connected Recovery Program that puts people first. It's led by WCB, but we have a partner administrator. And this is so that we bring together providers into one network for more coordinated and consistent care. So a network of providers that enable faster access, cut wait times, support people with care they need in their community sooner, a consistency of care and standards of practice, a better experience for people, both for the individual who's experiencing the injury and for the employer who supports that individual in the recovery and return to work. And a system that supports greater accountability, measurement of how we're doing and helping folks, transparency on where people are in the recovery and return to work, and understanding the experiences of all those that are part of our system here in Nova Scotia. So the new Work Connected Recovery Program, to start January 1st, 2026, really includes all of our programs that you might know under these types of areas and areas of focus. So Tier 1, so physical rehabilitation. It includes the services within Tier 2 and 3, which are more multi and interdisciplinary approaches to recovery for physical injury, for concussion, as well as for psychological injury, both traumatic psychological injury and gradual onset. And these two, of course, are part of our legislative mandates of how we support folks impacted by these really significant injuries and conditions. So we have partners in the program, of course. You folks on the line are critical influencers in terms of creating conditions to support the safe return of individuals and connecting them to the workplace and supporting that back to life and back to work. WCB Nova Scotia is a program owner for work-connected recovery. We have the accountability for the success and the evolution of the program, how caseworkers lead within supporting folks returning to work and through their recovery and rehabilitation. And we govern the program. And as I mentioned, we have a program administrator, our partner Lifemark, to offer faster access referral management. And they are accountable for service standards and providing the technology and infrastructure to bring the community of leading practice together with greater transparency, greater measures, and greater support for Nova Scotians. And the providers in the work-connected recovery, we're inviting all providers into it to express interest, and then that alignment of goal-based interventions, following standards and optimal recovery practices that we can learn from others and accelerate those that we know internally to Nova Scotia today, all enough to enable work-connected recovery. We believe that Nova Scotians are at their best at work in safe and sustainable ways. So I'm going to invite Lisa into the presentation, and I'm going just to switch the control over. Thank you.
Daniel, and good afternoon, everybody. I'm sure as we are going along today, some folks are wondering, this seems like a significant change. If you're coming in presenting to us, must be something big happening, and it's true. There's a big difference in the way that we're going to be delivering care. And I'm really excited about that. I'm sure that one of the questions that's on your mind is how this is going to impact you and your workers and impact the return to work timelines. As we go through our presentation today, I hope that we'll answer some of those questions. We're going to highlight a few of the places where things will be different for you, as well as some of the things that are not going to change. I think everybody is probably familiar, unfortunately, with the form that's on this slide. And this is the first thing that is not changing. When somebody at work gets injured, either the employer or the injured worker has a responsibility to submit an injury report to WCB as soon as possible. As I said, this is something that has not changed. And I would like to highlight that really the fastest and easiest way to do this is by submitting it through my account. As we move into the WCR, or the Work Connected Recovery model, we have 3 options for people to be able to refer to a provider. So the first one, we have a 1-800 number dedicated to workers in Nova Scotia, where we can book an appointment with the central intake team. And workers will be given the first appointment that's available to them in their area. You can also contact your preferred provider. We know many people have relationships already with providers, and the providers understand the work that the employers do. And so when we work with those providers, we tend to see really good return to work outcomes. So you can still do that. You can contact your provider as long as they're within the network, and that referral will be submitted into the central location and assigned to the provider of your choice. Third option is the employee walks into a clinic within the network and identifies as needing treatment. And then that treatment again will work with the central referral to make sure that they're signed up and that they are assigned the appropriate care. The other thing that can happen is that employees can be referred by their case manager. So after talking to a case manager on the phone, a case manager may decide that the worker is in need of treatment, and case managers can make that referral directly into the network as well. One of the really fantastic parts about this program is that we have a commitment for clients to be contacted within 24 hours of that referral to begin scheduling that initial assessment. This is something that we are really looking forward to, and we think that this is going to be a great support in terms of service for all of us. As I mentioned before, we know that some people have already connections and preferred providers. And one of the questions that we often get, and I'll probably repeat this message a few times through this presentation, just to make sure that everybody is fully comfortable with the information. Employers can refer injured workers to providers within the network. And only providers who are in the network can treat or bill for the care that they provide within that compensation system. However, every provider is invited to join. And when a provider joins the network, they are going to remain as an independent business owner, and they're not becoming part of Lifemark or anything like that. They are their own business. When they receive payment for the fee or for the treatment that they've provided, 100% of the fee for that service goes directly to the treatment provider. All treatment providers, as they are now, are required to treat based on the medical disability guidelines, which is a guide that we use to make sure that we are treating within standard practices. We're expecting that providers use the same consistent reports and processes. And we've had situations in the past where treatment may have been different in Yarmouth compared to Cape Breton or Amherst compared to Guysborough. And we really want to make sure that no matter where you are in Nova Scotia, you have the same opportunity to be able to recover and return to work, which is the best thing for you. And the final piece is that we are expecting that all of our treatment providers are committed to the philosophy of work-connected recovery. That's something that Daniel's going to speak a little bit more about, so that we're all familiar with this philosophy that returning to work is actually good for people. It helps them in their recovery. It enables them to have a fulfillment in their life, and really, it's the best thing for everybody. And so as we walk through the presentation a little bit further, Daniel's going to share a little bit more of that information so that you're comfortable with some of the terms that we use for the Work Connected Recovery Program.
That's great. Thank you, Lisa. So we can walk through this a little bit and get into a little bit more detail in terms of treatment and reporting. So right off the top, injured workers will continue to receive the treatment they need to recover, focused on goal-based attainment and supporting to return in a healthy and safe way to work. Employers, you will receive the functional information you need for return to work planning, supporting the conditions to enable your employee to be successful and to be supported in their recovery and safe return to work. That has not changed. As Lisa mentioned, we are using a focus on normal recovery, integrated care models, and leading practice in terms of injury recovery, treatment, and return to work. We're looking to also smooth and simplify administrative practices, and treatment will be conducted in block frameworks, individualized to a worker's recovery, they're individual to their recovery needs, as well as the return to work planning that needs to occur. So the functional abilities report, the framework might look similar. There's been some updates, and at regular intervals, you'll receive the functional abilities report, as well as what we're going to dig into a little bit more in the work connection status, to be able to support and track progress and bring those offers of safe, modified transitional work, if that's required, to support your employee in work connection. This is to unite us in a common language, and I'll chat a little bit more in the next slide, I believe. So a common language. Remember we talked about the employer, your folks, mainly the folks on the line, as well as your employees, health service providers, and WCB. We want to unite and connect around how we support individuals recover from workplace injuries and towards that work-connected recovery goal. We're saying that a lot. And to help celebrate that progress and also adapt and support the needs of the individual, to create return to work in sustainable ways and to keep employers involved in supporting and progressing return to work. So it's not this segmented all speaking different languages, but talking about how treatment supports recovery, how recovery supports return to work, and how return to work supports improvement, and a reconnection back to where folks were. So we want people to get their lives back to normal in a safe and sustainable way. So the work connection status is part of the heart of our work connected recovery program. It allows a common language between healthcare providers, employers, workers, and WCB. It is not a medical or clinical status or scale. It is observational in terms of and directional in terms of how does the treatment and the return to work plan progress and support, and where are we with that? So employers, you can offer safe transitional duties, be involved with return to work planning, and there's two pieces: that an individual is not currently working, and then versus they are working in some capacity. And of course, we want folks to return to full hours and full duties, almost as if the workplace injury from what happened didn't happen, right? That's our goal. Of course, we know that there's a progression to that, and everybody will be at a different place. And so what this allows us to do is, if transitional duties and return to work planning have not yet started, we know that that is a really important part of the treatment process, and it allows us to understand where folks are in their recovery and return to work, and to ensure that we all come together to support how we advance and support that individual with work reintegration, reconnecting to work, and reactivation. This is both for physical as well as psychological injury, and we know that there are many unique considerations of both. From an employer's perspective and return to work planning and goals, we want you to, of course, stay connected with your employee from the very first moment, supporting them in safe transitional work if that needs to be adjusted. And we want to provide better tools and clarity for you to step into that opportunity in a very connected way. And that really hasn't changed. We're just trying to bring better communication across all stakeholders through the work connection status. So we're seeking quicker access to care and more alignment on abilities and how that supports that safe return to work. We all want the same thing: Nova Scotians working healthy and safely. And if we think about it, the main folks that, now the individual worker is the most impacted by workplace injury, and then how we all rallied around that individual to support it. So if we think about from a worker, what does this mean? It means focusing the recovery on what you can do versus what you can't do. From an employer's perspective, it's staying involved and really offering suitable work and being at the heart of the return to work plan. For providers, it means delivering care that supports recovery of the injury in that goal-focused way to safe, gradual return to work. So it's treatment to support the return to work, return to function, return to life. And for what WCB, what that means is building a connected and an accountable system where care and recovery and return to work can happen together. This is part of what we believe in, that getting back is part of getting better, and that folks who stay connected to work in safe ways do better physically, emotionally, and financially. So I'll pass this back. Thank you.
Okay, so let's dive in a little bit. As Tracy mentioned earlier, there are some questions that we've been hearing more frequently than others. And so we wanted to walk through just a couple of those questions with you today as part of this presentation, so that you can kind of hear what other people have been asking, and gain that information as well. So the first question was, can I still work with my existing provider? The answer is simply yes. You can continue to work with your provider if they are part of the network. Providers are signing on to the network now. We've seen some really good growth in our network over the last couple of weeks. And the other thing is, provided the service level agreements are able to be met so that that injured worker can be treated within 3 business days. One of the opportunities that we have with this network is to make sure that people have faster access to care. And so a situation where we may suggest that an individual see a different provider is if the preferred provider isn't able to provide service for the next week or 2. However, if there is a provider close to home who can provide treatment the next day, then we would be encouraging a worker to go to that provider and get quicker access to treatment. Just as an update, we've had over 200 providers that have expressed interest in participating in the network. Many are in the process of signing agreements. And so if you do have a preferred provider, I would encourage you to talk to them about joining the network. We do want to make sure that anybody who would like to be in the network has that opportunity to participate and to continue to provide care to injured those patients. The next question people ask is, when is this going to impact me? For most employers in this program, we are going to be starting this framework and this program on January 1st, 2026. So really only 2 months away. At the moment, we are conducting kind of a soft launch where we're able to test and refine components of the program. This enables us to make sure that when we do launch for the larger group, we've worked out most of the bugs and are able to provide a safe and secure network that produces outstanding results. If you have questions about the soft launch, you can please contact us at wcr@wcb.ns.ca, and we can answer your specific questions there. Question, how do I access the reports? Earlier, Daniel showed us the grade report, and we've had phenomenal feedback on the reports. Those that have seen them to date have really shared with us that there's great information. It's very practical and usable information, and employers have been able to find appropriate accommodation based on the information that's been provided. If your employee is not at full hours, the functional abilities report with the work connected status included will be provided to you by the health service provider directly. And that's been coming in the form of email most recently. When will I know who has joined the network? And so from a treatment provider perspective, I know we like to have that knowledge of who is in the network to make sure that we're able to have our employees see appropriate providers. Our network continues to grow, and Lifemark, as the administrator of this network, is going to make a list of active providers available in the new year. However, we also have a 1-800 number so that people can call, and you don't have to worry about calling around to different clinics to get the best available time. You can actually just call the 1-800 number, speak to the central intake team, and they will be able to set you up with a treatment provider in your area within the 3-day business time. What's the plan for existing claims if a provider does not join the network? I know that this is a concern for many people, and I do want to let you know that work is underway to assess the claims that we have now and as new claims come in, so that we can make require transition to the new treatment provider with the least disruption possible. This is definitely a big task, and it's something that the team has been working on for a few weeks now, and continues to build and refine. As the network continues to build, we're seeing fewer and fewer claims that will need to be transitioned. But I think it's important to remember that at the heart of this is an injured worker. And our goal is really to be able to make sure that they have access to continued care through the duration of the recovery, so that they are able to have the best function and the best life possible, return to work at the appropriate time. So if a provider does not join the network and they are treating somebody currently, we will be working with that provider and the injured worker to transition into a new provider. So lots of words on this slide, but remind me again, what's changing for me as an employer in 2026? Let's start with the what's not changing. Submitting an injury report to WCB as soon as possible. Yes, please. The My account is there so that those can be submitted as soon as possible. And then you have the support of a WCB case manager to help your worker return to work. Access to functional information about recovery, 100%. The functional abilities forms that we have revamped are going to be able to give you all the information that you need to help support your injured workers' recovery and return to work. Employers' participation in return to work. Yes, we need your help in helping people to return to work. When there is accommodated duties or a gradual return to work opportunity, we see that employees are able to return to work faster and have a more successful return to work. Access to your preferred partner if they join the network. That's right. As part of the referral process, you'll be able to make comments to say, I would like for my employee to join this network or to be treated by this person. And as long as the treatment provider is able to meet the SLAs and provide the necessary treatment, we'll make sure that that happens. And your connection with WCB and caseworkers is not going to change. The WCB, the case management work is going to be done by WCB caseworkers as it is today. There is no plan to change the caseworkers that we have assigned to individual employers or to the injured workers that we have on the books right now. What's changing in 2026? Things are going to get easier. We have a new easy referral path. You can call a 1-800 number, speak to a live person, and make that referral so that your worker can have access to care. There's greater accountability and transparency of appointments and assessment scheduling. One of the great benefits of this program is that your caseworkers are going to be able to see the phone calls that are happening around appointments. We're going to be able to see when an employee is attending appointments, when they've missed appointments, and really be able to have that greater viewpoint into what's happening live in the claim. So that when you call a case manager in the future, what you're going to hear, instead of let me check with the treatment provider and get back to you, the caseworker is going to be able to take a look at the injured worker's file and be able to provide you with information when you call in. New reports that include work-connected status to support return to work progress of an injured worker. One of the focuses of our program is really around that work-connected status. We want to make sure that we are helping people to return to work as soon as possible so that work can be part of their recovery. And it's the reports that we have created for this new program really help to outline that. And there's never a question of whether or not a person is ready to return to work or ready to make their connection to work a little bit stronger. We have a province-wide network of providers so that no matter where you live in Nova Scotia, you are going to have access to appropriate care within standard timelines, and you are going to be able to have the same opportunity to recover as anyone else in any other location in Nova Scotia. And a better alignment across you and all of our partners. As Daniel shared, WCB, our treatment providers, we are all here to help support you and to help support workers in the recovery and then a safe return to work. So I mentioned that we've done a little bit of a soft launch, and I just want to share with you some of the early experiences that we've been having and some of the feedback that we've received already as a result of the work that's happening in the soft launch. The first was a really good news story with our first claim. This was a worker who lives in the valley, and they had a common sprains drain. And so I'm just going to walk you through kind of what happened as we were all very excited to watch the way that this claim moved through the referral process. So early in the morning, we got a call to say that the worker was injured and they needed treatment. That morning, the appointment was booked. Luckily, there was an appointment open later in the morning. The worker was able to go to the appointment, have their assessment, and by the end of the day, WCB had received a report. And what was the outcome? After the assessment, there was support for that employee to return to safely return to work on the very same day. I think that this is a fantastic story where someone is injured, they're seen, assessed, and have been able to return to work on the same day, knowing and having the confidence that they have the function to be able to do their job and to do the job safely. So this was a really good news story, and I think that it really showed the power of this program and the way that we're going to be able to impact positively the return to work outcomes. From the employer perspective, we've had feedback phenomenal at how quickly the worker was able to access care. I don't think anybody really expects that when you make a phone call to a healthcare provider in the morning, that they're going to be able to see you within a couple of hours and then be able to give you the confidence to be able to return to work, knowing that you've been taken care of and you're going to be able to return to work while you continue to recover. And then this is a comment that we received from Taylor Pond at Farmer Transport Systems earlier in October. The biggest improvement by far is the work connection status section. And this is talking about our forms. This section is intuitive and easy to follow. The manager had a better understanding of where the employee was in their return to work plan and could gauge when to start making preparations for a potential return to work. I think this really speaks to the value of having that work connected status. And, I can appreciate that when you're running your business you get a surprise phone call maybe from a caseworker to say your employee is ready to return to work next week or tomorrow, and you're like, oh my goodness, what am I going to do with them? The forms that we have and the way that this program is built, it's going to be able to give you the information that you need in a timelier way so that you know at every step what's needed of you as an employer so that you can support that timely return to work. Now I'm just sharing a few opportunities where you can go to gather some more information. If you'd like to take a look at the Work Connected Recovery Program in a little bit more detail and understand it a little bit more, you can visit our website, wcb.ms.ca, and look for it under the Work Connected Recovery page. If you have questions about this that you'd like to have answered, please reach out to us at WCR, so Work Connected Recovery, at wcd.ns.ca. And we have been publishing some great information on LinkedIn, so please feel free to follow along there at WCD Nova Scotia. Tracy, that's all of the presentation material that we have for today.
Excellent. Thank you, Lisa and Daniel. You provided us with a really great overview of the Work Connected Recovery model, and it's really encouraging to see how we're going to be able to connect workers to treatment faster and better information to employers. The chat has been really active. The team behind the scenes has been doing a great job, but there are a few questions that came up that I thought it would be good if we could bring to the larger group and maybe either have Daniel or you, Lisa, add some extra commentary to them. So let me see here. The first one that I see was from Julie, and it was really a question around how we were going to make sure that treatment providers still have access to treatment spaces when operating as independent business owners. She's curious about why clinics would continue to let providers use their treatment spaces and resources if they aren't being compensated. So I'm wondering if you could talk a little bit about maybe what is that relationship between Lifemark and the independent providers that are joining the network? Maybe there's a little confusion on that. And Julie, if we aren't answering the question right, maybe you could email the WCR so that we can get back to you and have that two-way conversation.
Yeah, I think that one of the important pieces to know about this network is that there's an opportunity for all treatment providers in Nova Scotia to be able to join. As long as they meet the criteria and have done the expression of interest, they're following their philosophy. Lifemark is there to administer the network. So there will be clinicians who are single business owners who may provide treatment from a local, maybe they have a home office or something like that. They're still going to be able to provide treatment the same way that they do today, as long as they're part of the network. So there are big group clinics that will join our network, but there's also individual psychologists and OTs and other healthcare providers that will be able to join the network and provide treatment in the same way that they do today.
Excellent. Thank you, Lisa. There was another question around the providers from Tom Champion of the OEA that was just wondering how we were going to ensure that providers would be committed to a work-connected philosophy, and how will we ensure that providers adhere to that policy? Janice gave a really responded to Tom, but I wasn't sure if you'd like to expand upon it, that Lifemark has already begun training their clinicians on the Work Connected Recovery model and practice, and will ensure any new clinicians in this network are trained too. Return to work will be led by the WCB caseworkers, and the collaboration between all people involved will ensure a timely and safe return to work outcome for the worker. I think the training piece is great, but I think Tom's question may be getting a little bit more to the quality assurance and how we will make sure that's embedded into the program.
Yeah, that's a really good question. Thank you, Tom. So Janice is right. Lifemark is going to be doing training to every provider in the network. And we've been a part of those training sessions to make sure that commonly Daniel talked about is used across the network. We have also built in a QA, so quality assurance, into the network. Every report that is written is going to be reviewed by the network's quality assurance, and feedback will be provided to providers to make sure that the information that they're providing is usable and it's helping with that return to work status. We've already seen this in action with some of our earlier plans, and we're really pleased with the results from that QA perspective. The other piece on this is that we talked about accountability, and I think this is probably what Tom is getting at as well. And through this network, we are going to be able to see more detailed information about return to work outcomes. What are the factors that are influencing those? And if there are spots where we may need to work together more closely with treatment providers to make sure that we have consistent outcomes. Hope that helps.
Thanks very much, Lisa. There are a few questions, just kind of general questions, because we went through the timelines and all of that quite quickly. So maybe either Daniel or yourself could just talk a little bit about what are the timelines from that like first referral to when the first progress report will be issued, just to remind the folks on the call.
And I think that this is something that we can publish a little bit later to be able to share it with everybody so that they have that from a better perspective. But what we're looking at generally is to be able to make sure that we are connecting with the injured workers within 24 hours of referral, so that we can book an appointment for that assessment within 3 days. And then generally speaking, and Daniel, you'll have to keep me honest here, we should expect to see that initial report within a week. Our experience to date has been that it's faster than that, but that allows us to be able to help with return to work planning and make sure that we have that information. From there, what I can also share is that progress reports will come on a regular basis, and those progress reports will follow the same format as the initial assessment report, and that means that the information that we're getting is going to be consistent, and we'll be able to see that the changes that are happening throughout that recovery phase.
Excellent. Thank you, Lisa.
Yeah, I might add that, from the assessment, Lisa mentioned the 5 days from reporting as service level agreements. However, from after the assessment, we know that that functional information is essential to support return to work planning at the employer. So after the assessment, the functional information will be provided to the employer following that in advance of the other types of in advance, I suppose, of the official report on the functional information coming to an employer. So we're trying to connect the information that will allow employers to create safe return to work plans at the point of assessment. Now, I also want to share that we're talking about both physical and psychological injury. And psychological injury is going to have unique factors that, and when Lisa's talking about publishing our service level agreements and the flow of information, there's going to be variation between both physical and psychological, and we're still working through that at this point.
Daniel, can I ask you just a quick clarifying question?
Sure.
So if the day that a worker goes for their initial assessment, is there information that will be shared back with the employer about function at that point?
Yes, that's correct. If the individual is not at full hours and full duties.
Perfect. So I know Lisa mentioned the week, but that's more of a more fulsome report that would come. There would be something that would happen quicker.
That's correct. Yeah, we're just working through that now. Things are happening fairly quickly.
Okay, folks, so more to come on the timelines. We promise that we will get more information out to you. Definitely know that early access to information is key to keeping people connected to work. So stay tuned for a little bit more on that. One of the other questions that had come through the chat that I think it's really important for us to handle is Helen had made a comment in the chat that based on what we had presented, she was under the impression that it doesn't seem like an employer would be involved in return to work planning until stage 3. And she's commenting that, I'll read it verbatim for you, Lisa and Daniel, just so you can take what you want from it directly. Helen says it's disappointing to see a functional abilities form that suggests only down the road than at the very start an employer is involved in the return to work planning. With all due respect, as an employer who has an active and robust return to work program for workers, this employer will be involved from the very beginning of each and every injury rather than be advised when it's appropriate. And Helen, we are thrilled that you were
Yeah,
involved early
100%.
at the beginning. So I think that there's a little bit of clarification Daniel or Lisa could provide.
Yeah. Thank you, Helen, for pointing that out, and thank you, Tracy, for raising that, because you're right. And I think through our presentation, we had hoped that that would come through, that people's roles and responsibilities in this network are not changing. We're very happy that employers are active and engaged from day one. I think when we look at the work connected, when we're looking at that status bar, I think employers are involved in communication full way. It's so important that you are and that you're supportive of your workers so that they can come back to work as soon as possible. Case workers are very good to help and question to know when accommodated duties or transitional duties are available, but that is something that employers have to be looking at. And honestly, if we could have everybody back to work on day one because employers are engaged and able to do that, that would definitely be a celebration for us. So thank you, Helen, for sharing and making sure that you reinforce the importance of the employer's role in return to work, and that you do help to drive that return to work outcome. Yeah. Thank you.
Excellent.
So in that case, I just want to share, like, stepping into that conversation a little bit more. So as an individual is received and the employer has offered and modified and adapted work so that their employee can stay connected to work, there's no leaving work per se. As that comes in, we would see that a work connection is already there and very strong, like a 7 in terms of full hours, or an 8 at their pre-injury duties. So that's where we're looking to really where somebody's starting from. The employer is offering and making safe work happen immediately, even before WCB is aware of this. So I just wanted to share that. A little fumbled on that, but that's the same spirit.
Great. Thank you, Lisa and Daniel. We have probably time for a few more questions if you'll indulge us. There's some great ones in the chat here. Ryan had asked if there's any change to providing treatment while the claim is pending, or are we still only covering the initial assessment until adjudication has been done around compensability? There was a response in the chat that the first block of treatment is automatically approved. However, the assessment determines compensability. So maybe tell us a little bit more about what's in the first block.
Sure. So the block framework that's been designed is really to be in line with the medical disability guidelines and recovery timelines. And so in that block is really what we would package as what's needed for an individual to recover and return to work from that acute injury within those timelines. There's some more details in the time of a block and pieces like that, but generally speaking, the block is would include the assessment, the treatment, and any of the modalities or interventions that a person would need to help them with their return to work. That could include a home exercise program. It could include physio. It could include whatever really the treatment provider is deeming to be necessary as part of that treatment.
Excellent.
There are many injuries where we also have to determine entitlement, and that assessment will be pivotal to that, to determine treatment and what is determined to be work related as we move forward. So there's going to be some combinations here as we're working through, depending on the unique characteristics of the injury.
Thank you. Let's see. There was another question about whether or not there's any future IT changes at WCB related to having the reports and forms available on WCB Online once they're completed versus relying on email or fax from the providers.
So I think some of the good news on this is that we are going to have one form And that's something that as we dive more into this network, and there are still some IT things that we are working through, as you indicated, to be able to make it easier for employers to access those reports.
Perfect. Thanks, Lisa. There's a follow-up question to the one that we just talked about, what's included in the first block. Hillary was asking, are you planning to do all that treatment that you talked about before adjudicating the claim in the 4-week period? So I think there's some confusion about in that first block, if we're approving it versus kind of just an initial assessment is how it works today. We approved the initial assessment. So it sounded like in that first block, there's a lot more treatment and care. So can you just comment on what's the different experience that a worker and or employer would have in this new model for that first part?
So I think generally speaking, that assessment is going to be done and completed. And it will be kind of just weaving in time with the caseworker's ability to make that adjudication decision to know whether or not that injury is compensable, so that the first block can continue.
Perfect. Thanks for that clarification, Lisa. Tony is asking, are there any changes to reporting requirements for employers? And I may just take that one. So the injury report up until December 31st is due within those 5 days, but we do know that the sooner a report of injury can come to us, the sooner we can action it. There has been a recent change in our legislation that becomes effective January 1st, Tony, that moves the reporting requirement from 5 days to 2 days. And we will be back to talk to employers a little bit more about that and the impacts, but there is an upcoming change to the reporting requirements based on the legislation change that was announced a few weeks ago. Mary Beth had a question. If an employer puts into place preventative programs, do they get credit for these efforts, financially speaking?
I would say it makes their businesses much more efficient and effective. And of course, the engagement of their employees and how that adds to their organization. But also, we're on a premium-based system. And so as the cost of workplace injuries are reduced at an employer level and a sector level, premiums are also reduced on that end. But I'd open up the question, Tracy, to perhaps to you and your group.
Yeah. So right now, Mary Beth, financially speaking, if you have those preventative programs in place, that will help you financially. There is no additional incentives from the WCB for those preventative programs, though. Okay, let's see. One other question here was from Daniel, and it says, will contractual obligations of all parties be made clear to the public? It would be appreciated to have some transparency to each party's role, responsibilities, timelines, not lifetime, sorry about that. What are the KOIs being tracked by the WCB to ensure these changes achieve positive results for employers and employees beyond simply cost and return to work date?
Yeah, I think that's a good question. It's certainly, we will be able to share the roles and responsibilities, as well as what we're measuring and expecting from KOI and a service level agreement perspective. So we don't have them at the moment ready to share today, but that will be part of our efforts, and we'll take that away to be able to look into sharing that with everybody. Sure.
Wonderful. Thank you again to Lisa and Daniel and to all of the participants for joining us today. We are at 4 o'clock. As I mentioned, we will do our best. We didn't get to all of the questions in the chat. We will do our best to provide responses to those and to be able to post those along with the recording of this and in about a week's time. We are in the early stages, like Lisa and Daniel mentioned, of a soft launch. We will continue to learn and change the program as we go. So stay tuned. Your feedback has been really appreciated, and I wish you all a very safe day. Take care.